Hi everyone, it's Marty, and this is going to be part two of my health update video. And today would be Friday, April 18th. So I decided to go on and make part two to keep you guys updated with the progress as it happens. I've gotten a couple of questions, and I think the best question, the best inquiry came from my dear friend Wendy from California. And she asked me kind of a two-part question. So, what do we do moving forward? And number two is was I afraid of what was happening and what was going on? And I don't mind sharing that with you. Um, so, on number one, as far as moving forward, yesterday I went to my primary care physician. Her name is Gloria, very nice young lady, and she helped me with setting up the biopsy and getting a general surgeon. Of all the doctors that I have, I do not have a general surgeon, so she set that up, and the general surgeon was right there within the office complex. So I basically just kind of walked across the hall and got my information and paperwork, and so we have a meet and greet set up for Monday, and that's just basically decide what we're going to do as far as which of the lymph nodes that they will bring out. There are two of the seven are pretty big in size. They're not huge, they're not like inches, but they're about 4 meter or 4 centimeters by 3 centimeters, and they'll have to decide at that point, which one is in closer proximity to muscle, or how close to one of it is pretty close to the femoral artery. So I don't know if they'll take that. Um, so I get to meet with the general surgeon on Monday, and we'll see where we go moving forward. As far as my neck and having the screw loose, I'm waiting on my surgeon to return from Israel. Um, he and his family went on a little vacation to Israel over the Passover holiday. So upon his return, I will have his scheduling secretary squeeze me in as rapidly as possible. The only reason I wouldn't be able to meet that is if the headaches or the pain just gets unbearable. I almost went to the hospital on Tuesday because it just got a little bit too much to take and too much to bear, and my vision got blurred, and I got really nauseous. So that then if you've surpassed your pain threshold, then it's time to see a professional. So which would have been the emergency room at that night, being as my surgeon's on vacation. So that kind of wraps up the first part. The second part is, am I afraid of what's going on? And I'll tell you exactly what I told Wendy. And I don't have the luxury of being afraid right now, because I have to take care of what the clear and present dangers before me, which are my father's care, and who will take care of my mom and dad should something happen to me in the interim. Now, I don't expect that anything should happen to me in the interim, but with the neck being is the way it is, if I should have to be hospitalized even for a day or two, that care has to be present for my father, and who will support my mother through with the back and forth and the daily maintenance of taking care of my father. It's a full-time job. I have set up some safety nets, and should I be hospitalized, Dad will go to it's a long-term care hospice that is right near the hospital, because that's who would take care of him in the long-term situation. On the short term, the hospice that we're with right now it has residents at the Christiana Hospital, and I do have some respite time that I built up, because obviously I wouldn't have taken a vacation this year. So there's some time there where he can be cared for, and given all the care that he so richly deserves. So yeah, I'm not. It is I just have to meet my appointments, and let the professionals do their job here. There's really not a whole lot that I could do. Just on moving to my next frame of thought is what does it mean as far as my day-to-day living? Well, one thing is I can't exercise. Um, I can walk, but it's really not probably a good idea not to do with somebody with me, just in case I get one of those woozy moments, and I've been having a lot of those lately. Um, So, and you know, my sugar gets low, so I really can't, and my appetite is just like way through the crapper. So it's really not a good idea to just go on I mean, like, I do crazy walks. Like, I'll go walk for like 7 or 8 miles and just not even think about it. So I just can't pull that crap right now. So I don't know. I'll have to see what I can do. It's really not on my highest priority right now. It just meeting my caloric needs is my highest priority right now. Sometimes I've had to throw carbs in the mix, which I hate doing, but if you got to meet a calorie need, then you have to meet a calorie need, and it just is the way it is. Um, so this morning I couldn't eat anything, so I wound up having a carrot cake muffin because I knew my sugar was getting low. So that's that. I mean, yeah, you have to do what you got to do. So the exercise thing bothers me because I mean, obviously my marathon's out this year. That I mean, that I've trained so long, and I don't see any running in the near future. So it deeply saddens me, and it's not an exercise craze thing. You have to understand, I depend on the endorphins for my exercise, for my pain relief. I depend on them on a daily basis. If I'm hurting, nothing is better than getting my blood flowing and getting those endorphins going. It is the greatest natural painkiller on the planet, hands down. I mean, if you don't know, now you know. Anyhow, I had a rough morning this morning, but I'm feeling a little bit better this afternoon, so I'm gonna try and get some laundry done and uh, hopefully make it to a Good Friday service. I haven't been able to recognize any of the holiday, and I'd like to get to mass at least once over the weekend. We clear missed Palm Sunday because I had a bad day. So anyhow, I hope you guys are having a good day, and I hope I've answered some questions. You know, I'm not the greatest video guy, but I'm hell bent on trying to reestablish some connections with you guys, and I need you to know that if I haven't answered your email, or if I really haven't responded back to you, and you've been so kind as to send me a message or a note or something, that I can barely feel most of my right arm, and my neck hurts so bad. Every keystroke is a job for me. And I do get those moments where the pain medication brings me some relief, so I try and get on and jump on as much as I can. But if I have neglected you in the past, from the bottom of my heart, I apologize, and it has nothing to do with your importance to me. I try to read all of your posts and your updates and whatnot on the social media, and I'm trying my very best to keep up with you just by reading what your posts are. Um, and I realize that I've neglected quite a few people, and it certainly wasn't out of disregard or importance. It was simply because I have a very difficult time typing. I did manage to buy a version of Dragon Speak. Um, I'm so technologically not gifted, so I have to figure out sometime this weekend how to work that thing, because I could just speak right into it and it'll reply to your comments, and I can start catching up with folks. So um, happy Good Friday if you celebrate. If not, then I hope that you're enjoying the warmer weather, and that you have a really nice weekend. I will keep you up to date with new information as it's given to me. I am just as clueless to what's going on as you are. I can only rely on the advice and that the professionals give me. So have a great weekend.